different thoughts.
So good morning to you, Marie Matson, with some local healthcare providers, Dr. Mystique Grove and Stacy, and we have Melissa as a guest with us today, and we're just going to talk about these very stressful times and what we're seeing in our local area, what we've had maybe personal experience with as far as difficulties or stressors or what's happening in life in general. And so there I won't get any. All you see is my blue filter of my glasses, which is great, but also distracting. So
I see
good morning to you,
sunflowers.
ladies.
I know, that's why I took mine off too. It's like a little.
As long as I don't have to read, too much. You can tell we're over 40, right?
Or over 50.
Or yeah, all of those things. So good morning and thank you for joining us. And, there's a pretty stressful time going on. All of us that you see are in the healthcare field, and we are dealing with things, some of us more than others on the front line. And just wanted to check in with one another and see how we're all doing and what you're seeing as far as people coming in, symptoms. How are people feeling? Are we, fearful, or are we hopeful, or that kind of thing? Do you have any comments?
I'd love to hear from Stacy because she's in the hospital.
Oh, yes.
And so
I mean,
the local hospital, I should say.
Definitely on the front lines. Yep.
Yeah.
So I mean, it's been stressful in just trying to when it first started, the stressful time of organizing and making sure that everybody has their right protective equipment and how we're going to do procedures, what procedures we're going to do, what's going to stop, and just trying to maintain the level of sterility, I guess you could say, so that people feel comfortable coming to the hospital. And I'm not sure that we did such a great job at the beginning. And I think a lot of the news media freaked a lot of people out to the point of not coming in, which has been kind of detrimental to their own health. And we're now, 8 weeks into this? And we're starting to see those patients come in a kind of a train wreck. And it's unfortunate that not everybody knows like really what's happening on the inside. We get a count of very sick people on a daily basis, so we kind of know what's going on. And that number has, yet to reach 10 on any given day. And I think it was 5 the last time I looked. So
can you comment though on what kind of patients, like what conditions you're talking about? Are you talking about general conditions or specifically?
Well, for me, because
we're all worried about.
Yeah, so I'm in the heart field, so that's what I'm seeing is patients that have had, symptoms at home, chest pain, shortness of breath, some of the same type of symptoms, but maybe not as severe as the illness that's kind of getting people right now. So, and if everybody is so great at either Google MDing themselves or attributing it to other issues, like, oh, it was my acid reflux, or, oh, it must be my GERD. Oh, so they're chalking it up to something else when in reality, they could be having a heart attack or they could.
Yeah. And what I've been hearing from, I'll say friends or relatives, is I don't want to go to the hospital. We will be separated. I won't be able to be there with them. And I would rather stay home and be with my loved ones if I'm going to get something horrible or if I'm going to die, because I don't want to be alone.
Yeah. And that is a real thing. They're doing a lot, the nurses are doing a lot of FaceTime with family members. It's tough. I was down in the ICU yesterday and the nurse was kind of telling me about having to FaceTime a family member as they're dying. It's just a horrible thing because family is so important on recovery and comfort, especially in a scary situation. Like some people just don't go to the hospital or it's been years since they've been there. It is a very scary situation. Now I do it every day, so it's just norm for me, but to be a patient in the hospital, it's just scary. There's, bells and whistles going on and people coming in to poke you at all hours. And I mean, you don't hear everything, or you hear too much, and it's just nice to have that. They always say, bring somebody with you so you have an extra set of ears, making sure we get going through medications or what they need to do with the dressing, and it's just unfortunate that we're in this position right now where people are having to try and not only the stress of being sick, but not having to remember all of it themselves. That's very difficult.
Do you think, Stacy, that maybe going forward discharge is going to look differently, where they're going to do some sort of FaceTime or other video
I think
conference so. and bring everybody in as a team?
They are definitely open to having family members on FaceTime on discharge, and our physicians are doing like this, a Zoom call follow-ups. We're just now starting this coming week. We're going to start doing appointments where people can actually come back into the office. And starting May 18th, our side of it, which I do the ultrasound of the heart, we're opening it up wide open because, like I said, these patients aren't coming in and they're getting sick, and they're just being told not to come into the hospital, but we can come in like to the clinic side, and we'll start opening 4 rooms of cath again. And right now it's just been more super emergent critical. And now they're going to get people who are maybe not elective, but if we wait too long, it could be critical. So those are who's going on the books next.
Right. So what I'm hearing from you, Stace, is that the hospital is feeling more confidence in clinics about being able to manage patients that come in. So now they're opening up and allowing certain patients to schedule.
Everybody that comes to the door is getting a temperature check. Every open door into either the clinic or the hospital, including employees, all getting temperature checked, all getting a mask. There's nobody walking around with an open face right now. In all of our workstations, because we can't keep the 6 feet apart because our computers are so close. But they've now just installed some of our programs into the rooms where we actually do the patients. And so we can actually spread out a little bit and write our studies up kind of separately if we want to. But, we're all being diligent about it. I mean, nobody wants a second wave of sickness. And so we still have our guard up and the rules are still in place. It's just going to get a little bit busier. Our hospital is about 250 bed, and we've been running real low around 150, 160. And so
which is really low, because usually we typically we've been high census in our hospital.
Yep.
And so you do
and diverting to Seattle because of it.
Yeah. And so, I have a neighbor that works in a different department, and he's been home on low census, which hasn't happened in years. The neurology, he's in neurology, that he isn't there working. And so that's kind of a surprise to me. But again, we have these people that just really they're going to stay at home longer. I'm hearing that from the paramedics as well. Their call volume is down a little bit. Different types of calls now. And people really don't want to go in. Even if they have a broken limb, they're really trying to stay home and just because they're fearful. And I am hoping that people are a little bit more reassured that we are in the Pacific Northwest moving through this a little more quickly. We hear these scary statistics.
Of course.
But, I know even Dr. Mystique, who does video, consults and things, even her call volume is down, and patients just are not even seeking any kind of advice. They're just
everybody's just hiding in their little holes now.
And I am seeing a lot more in my field. I'm doing a lot more with stress, and I'm not getting the calls or the emails. I'm just now starting to have people ask.
And it makes you feel like, oh, is everybody healed? Nobody's getting heart disease anymore? Nobody's sick? What's going on?
No, they're all fretting at home. No, they're all fretting at home, and they're day drinking, and they're, I mean, I saw a statistic the other day that said that 47% of people who are working from home, like they're doing their job, are drinking on the job. Oh I'm just like, okay. That's a perk, I guess, maybe.
Maybe.
Maybe. But it's a coping mechanism, and it's not a healthy one. So I am hoping that we are getting some sort of resemblance of the new norm as I'm calling it kind of a re-entry phase, as we do drop some of these very strict guidelines and able to be out and a little bit more social. Melissa, can I ask you, I know that you're a caregiver. Are the people that you caregive for, are they also feeling fearful? Not any feedback from you?
Yeah, well, I have 4 clients, one of which is my son, and then Dr. Grove's daughter. So, I get that. But then the other 2 don't even, I haven't seen them since this whole thing started.
Wow.
So
Yeah.
they're
And why
staying home.
is that? I mean, are you not caregiving for them, or what's happening?
They're afraid to let anyone in.
Oh, I see.
So it's a husband. I mean, no, it's a mom and a dad, and they live separate. So the kids switch their home every 3 days. They go back and forth. And that I would go back and forth to each place when I would caregive for them. But I haven't seen them in 2 months.
Wow. So that is stressful for you because you're used to caregiving for that individual, but also stressful for each of those parents who are now full time.
Yeah.
Without help.
Yeah.
And that's, caregiver burnout for all of you, whether you're the parent or the caregiver, is a real thing. We're all, although Stacy sounds like you're continuing to work maybe more hours than you have before, I don't know.
I mean, I'm still working 40 hours. Yeah, we're still busy. I mean, we're doing 20 to 25 patients in the outpatient facility, and our numbers are getting higher in the hospital. We were down to like 5 and 6, and now we're back up to 15 to 17.
And I don't know, we're hearing lots of things. You keep adding to the long laundry list. Ooh, here's my hands. And then they disappear when I go like here. We're hearing a long list of symptoms being added to this current illness. And so people kind of scratch their head and go, well, is that this? This latest thing with the toes is kind of interesting, or young people having sudden strokes.
Like blood clots. Yeah, I've heard that too. Blood clots,
yeah. Do we have some of that happening locally, or you can't really attribute anything to that?
I mean, I'm not seeing that. I haven't heard anything from the physicians talking about that. And I haven't seen anything echo wise, as far as what I'm seeing in the heart, Yeah. I'm just not really, a lot of the numbers are based on the big dense areas, New York City, Louisiana, Detroit, like all these high dense areas. And it's hard to put that into our little town of 100,000-ish,
Yeah.
and say that we are going to have the same results as they're having. I mean, I'm glad that everybody's being cautious, but they don't need to be freaking out about it. We're all just doing precautionary right now. I don't believe in our community we've seen an overabundance of anything different than the regular flu season,
Yeah.
Yeah. I want to comment a little bit on that. Because we've got a few different categories. We've got the severely symptomatic people. We've got the symptomatic but easily recover people, mild to moderate. And then we have the asymptomatic people, which they, at least for a time, it's believed that they can be contagious. And it's very possible healthy people are going to be in that last category, that latter category of the asymptomatic. And so it's possible our region as well, besides the density, which is a very good point, is our population. We've got lots of local growers and farmers. We've got lots of hiking, walking, biking, part of our environment contributes to our physical activity for many people here. And I do believe that it's possible we have a healthier population in general. We've got lots of, open markets, food cooperatives, lots of healthier options, not a lot of junk foody type of people here. Potentially, I know Stacy sees the other end of that, and I see quite a lot of the healthy people of that. So we're actually quite on different ends of that spectrum.
Yeah.
And I would say that it's possible we just have more asymptomatic carriers. Without testing, we can't prove that. There's also, even when they're looking into the treatments, they're looking at, how many people actually have antibodies, which we believe will be suggestive that you have immunity and or long-term protection once you've been exposed to it or had some immune response, which is typical with most illnesses. And there is some possibility that not because this one's acting a little different, there's a possibility there's maybe even a higher percentage don't even have antibodies. So that then makes you question, assuming we even have valid tests, that how much are we really capturing of who's positive, who's negative, who's got antibodies, who's got immune response. There's still so many questions on that. And that's why I think research is going to how we can test people appropriately, whether it's the viral load, the antibodies, and then of course treatments, and where do those treatments target people. But I think in general, my impression from watching how things are going is I think we're healthier. I think there's more of us that are healthier here.
Well, I would agree with you. We tend to have a better air quality here, typically.
That's very true.
Just because of where we are, how many trees we have. I mean, they're really, you want to do something great for the environment and go plant 5 trees. It's really helpful. But I know even in general, and this goes back quite a ways because microbiology was like 1993, 94. There's a population always that there are silent carriers of things like strep and staph. And so it doesn't surprise me that we have a population of silent carriers or asymptomatic. I keep comparing this current situation to chickenpox. It's what reminds me the most of it. You can have chickenpox circulating, and it's a 21-day incubation period before it shows up. And this, I can remember my mom purposely taking the 3 of us kids all at the same time to play with somebody that had an active case of chickenpox so that we could all 3 get them at the same time. And then she wouldn't have to be
herd immunity. I've heard people wanting to do that with this one that's going on right now.
Right. And so, but it is this unknown factor of how does it affect each individual. And in some ways, I think it really has a lot to do with our genetics. How will it affect me based on my genetics? Do I have a family history of asthma, heart trouble, these kind of things? And so does that mean it'll affect me that way? It's so varied, we just don't know. And that unknown makes us fearful.
I think that the comorbidities, the diabetes, the heart disease, basically inflammatory conditions are going to be the underlying susceptibility. So herd immunity usually is a very positive thing. It's a very good thing, especially if you have a healthy individual exposed to something like that, then your response is going to be mild or minor.
Right. And
I do not recommend attempts at herd immunity if you have comorbidity, because that's what gets people the more severe symptoms. So the idea of wearing masks and gloves and not going out in public and the 6-foot distance is very important for those people that have that.
But there's so many people. There's so many people out there. I go to the grocery store and I swear more than half of them don't have anything on. They're not protecting themselves at all, or others. They're not wearing gloves. They're not wearing masks.
So those are the people who feel they're healthy. They don't want to they don't think they're going to have a problem. They want that herd immunity, or they are trying to make a point to the government you can't mandate me. You're taking all my freedoms away.
Which is the new thing that's coming out, right? So
Right.
what do you think, Melissa? Do you think that everywhere we go, like now the airlines are saying that you have to wear masks, and so is Costco, like, do you think that all the stores and major companies that we attend or go to should wear masks and gloves? Should we just walk around covered everywhere? I mean,
I see the employees are all wearing theirs, but it's the other people going in that aren't. I think for now, because everything is so unknown, it's a good thing to protect yourselves or others with wearing masks and gloves. I still do.
Can I chime in my opinion as a doctor on that? I think if we are going to be exposing ourselves to public, like in lines, cashiers, touching things, that yes, I think that's very reasonable, at least for the mask part. Okay. But this walking down the street, jogging, doing outdoor, not anybody around you thing, like banning fishing, when fishing by the very property of fishing isolates you from people, that is ridiculous.
Yeah.
I think that exposes people to hyperventilate. There was a recent crash, I don't remember where somebody passed out trying to breathe through their mask driving. Oh, come on.
Why would people wear a mask in their car by themselves?
Anxiety.
Right.
Anxiety, the whole media hype, panic.
I don't want to take it on, take it off. It's, if I leave, kind of like, I don't want to leave it behind. My concern, and I have to say, and I totally understand the workers that are at the grocery stores, that are at places like Costco, that want to wear a mask. If they are symptomatic, they don't want to give anything to the customers that are coming in. My concern is that the masks that they are wearing they're not like an N95 mask where they are a respirator and they're not able to blow off their CO2. They are wearing them all day. They're very hot. They take them off to eat. And when there's a proper way, and I think, Stacy, this is maybe something that came out at the clinic and the hospital, the recognition of discarding and taking off the PPE and disposing of it carefully, so that if there is anything on the outside of the mask, the gloves, the gowns, the whatever, that it gets properly put in a sealed container that can be taken off.
People just are not being educated. I had a gentleman the other day, he had it completely upside down, so the nose piece was under his chin, so he wasn't even pinching on his nose. And then when it fell off, he took it up and put it on inside out. And I'm like, well, you just defeated the whole purpose of wearing it.
Yes.
So people are really not educated.
Yeah.
In sterile technique, you learn when you touch something, you see the little green blobs, right? Everywhere you touch, then it now has affected other things. And so I think if people actually saw, how a piece of bacteria transfers, maybe people would be a little more careful about donning and doffing, which is taking on and putting on. I think if they knew that, we would see it'll be a little bit different.
I've seen people wearing masks with their noses uncovered.
Yeah.
And I understand, because they're having a hard time breathing.
Right.
And that tells me that either the mask isn't appropriate for you, or it's too tight, or there needs to be a break. And that's something maybe that employers could do for those who are on the front lines that are constantly in the mask, is maybe they need short breaks, like people that used to smoke. I can't imagine what the smokers are going through right now. But those that need a break, to just periodically breathe regular oxygen, fresh air, free airflow. I think that would be really helpful, both for the mental emotional state, but also for the acidity. Because I want to tell you, when I read a lab report, it can say high CO2 when you do your electrolytes or chemistries in the blood work. If it says high CO2, it means you're not breathing deeply, or you are not getting enough oxygen. If it's persistent, then it's a chronic problem. And when you are high CO2 in your blood, you're acidic, which means you're inflammatory or pro-inflammatory. If you take 5 deep breaths and do that, you can actually change that CO2 to a normal range, just doing that. And so breathing it needs to be part of our therapy for many reasons, but I think that could help with some of the mask thing. I will comment on allergies right now. I don't know, I've got allergies. So every once in a while I sneeze. Not pleasant in a mask, I might say. Because here you are trying to, like, hand a cashier or whatever, and now you've just sneezed in your mask, which, hey, it worked. But at the same time, now you're like, you know, and you can't touch it. You can't take it off. You can't do anything. Oh,
And then
so
you're looked at like,
yeah, then you're treated. Okay, so I was at the post office, and this is an example of people maybe taking it too far. Yeah, you're looked at like, oh, zombie's gonna attack me kind of thing. But like in the post office, they have the little X's where you have to stand in line. A person in front of me was clearly very anxious about it. Everybody in the business had a mask on, and she was leaving an extra X in front of her. And a gentleman started to walk past her. He was probably still 2 feet away from her and masked as she was, to reach for something. And she backed up from him and almost ran into me in her panic to get away. And I'm like, oh, I just, so we are taking things too far in our anxiety and our panic. I think reasonable. And I think really the people who work in the hospitals are the only ones, or people in caregiver perhaps, that are very comfortable with their protection, and so many people are not. And there's got to be a way we can educate people, the general public, on masks. I know there's little videos here and there. So every time you see someone wearing it incorrectly, I hope
or
you're
even
helping
wearing
someone.
an N95. The public doesn't need to wear an N95 unless they're in contact with somebody that has this illness.
For some people,
But you
that's all
don't
they
know.
have. That's
Well, you
what they
don't, you,
had on
you
hand,
will,
so they're using it.
I'm talking about diagnosed with this illness.
Mhm.
That's just, I mean, we wear regular surgical masks unless the patient has this illness, and then we wear the N95. And if you've not been fit tested for an N95, it's not going to do you any good anyway. So
I've seen some severely susceptible people wearing them, and I think it's for their mental state.
I think you're right. As long as you don't wear it upside down.
well,
And there are that, yeah.
And there are, like Stacy and Dr. Grobe. I mean, when I was in school, we learned sterile procedure. When I wash my hands, even now, before all of this very stressful time, there has been a there is a fingernail brush at my every sink here at the office and at home. And I will wash my hands briefly and go to the other sink that has the fingernail brush. I am so used to washing in sterile technique all the time. It is just second nature for me. So it does seem a little over the top maybe to some people, but it's just what I've become accustomed to. I do have to lotion my hands and all that kind of thing because I do prefer hand washing over gel. All the alcohol gel is just, to me, in my immune system, overwhelming. So I prefer to wash with soap and water, and then I'm using lots of hand lotion in between.
Mystique,
Well,
what do you see about the future with people spraying their masks with Lysol and overdoing it with the bleach? And I mean, do you see a future
we're
of
seeing it now. We're seeing the
rashes and
consequences of that.
asthma?
Okay, spraying your mask with Lysol, you have just created a poisoned inflammation to your own respiratory passage, your lungs. So please never do that. As far as, especially adding things to synthetic products, like some people are wearing synthetic fabric, synthetic, even the N95, that kind of stuff. You do not add more chemicals to synthetics. Oh, you're just creating a cocktail of fumes. The hand washing, as Marie mentioned, is highly preferable, and all people have said that, even the CDC. But when you're in like I'm in the grocery store, oops, I just touched something, or I've got like the gas handle, I forgot my gloves or dropped them somewhere, and so I'm like, okay, I need to spritz my hands after I just touched that. And so having a hand sanitizer is really useful. The problem, what people don't understand, is is the antibacterial is not helping you in this situation. We're dealing with a different kind of organism. We're dealing with a virus. And then the second thing that we have to remember is that many of those are very drying. So people are getting cracked fingers, they're getting dry hands. And then if you add chemicals, like some of them have the triclosan in them, you have added a poison to your system that lowers your immune system if you use it all the time. So people are having cracked and bleeding fingers. They're actually allowing themselves the opportunity for a lowered immune system and a secondary infection. And that's frightening right now. So I strongly recommend, if you make your own hand sanitizer, you add a little bit of fractionated coconut oil to it, because fractionated coconut oil stays liquid. It does not go solid. And it allows, and it also doesn't clog the sprayer like some of the other oils can, like olive oil. And it allows your hands to retain some of the moisture. Moisture and oil on the skin is a barrier, it's a protectant. That's why we do not want to use soap on our skin when we shower all the time. I mean, you want to use obviously the stinky, dirty parts, but you don't necessarily want to use soap every inch of your body all the time, because you're taking away that protective layer. And that's why people are getting cracked and bleeding, etc. So if you add that to your hand sanitizer, which are usually high alcohol content, that would help. And that's partly why aloe is included in that, is to be a little bit of a protective, moisturizing, but it's not very long lasting, whereas oils will seal things in better for you. That would be my recommendation, and avoid anything with triclosan. So moving forward from here, I'm hopeful that we're just wearing masks when we're out in concentrated public, and gloves if it's appropriate for whatever surface you're touching, especially very public, especially PIN numbers, and the gas station type of thing, shopping carts. Although I've noticed some stores are really being very good about providing the wipes and things, which is really, really nice. And then, of course, carrying some little thing in your purse. I personally prefer using essential oils in my hand sanitizers. They've been used since Egypt, the times of Egypt. And so we know they have medicinal properties. It's been highly undermentioned with our pharmacy suggestions.
Hand sanitizer, and my hands are so, they haven't cracked at all. Like,
yep,
they're soft,
and you have gloves, and you
I've-
have to use sanitizer all the time. Yes, and
I just carry it in my pocket.
Yeah. Yeah, but research, which ones have those properties. You can't just use,
I took one of those little travel bottles, and I put soap and water, and it's a more concentrated soap and water in there, and it's in my car. And after I've gone shopping, I am wearing gloves when I'm shopping, and then I take them off. Sterile procedure, right? Take them off inside so that the germs are inside, rolled up in a ball. I have a little bag in my car, and they're fabric. And then when I get home, I put them directly into the washing machine. So it's just become a little bit of a routine. And I think we're going to see that, at the office, as people are coming in again, as the clinics open up. Maybe Stacey, you've been a little bit more closed at the office, right? I think, there you go. Yay.
I didn't touch anything, and it's inside out.
And it's inside out. I think that we are using, wipes on the handles, and patients are being very respectful about that. They're appreciating that. I'm really hopeful, as all of our hair is growing out, and the grays are starting to pop out every which way. The people that do hair and nails, I understand that we don't think it's an essential service. I beg to differ, especially with the nail techs that do pedicures. A lot of people that I know use that service instead of going to the podiatrist. They're keeping their toenails from getting ingrown and things like that, and they are very sanitary. The hairstylists and colorists are very sanitary. The states have made it so, and they are willing to change their gowns and things in between, and have a mask on so that they can get back to work. And I think it's helpful for the economy, but the mental emotional state of us all has, I think, really suffered more than we're willing to admit.
Stacy, you mentioned the other day that, you know, there are more people dying from not coming in because of their mental emotional state. And also, as we're moving forward, you said somebody had mentioned, so there was difference of opinion. Some people think, oh, we haven't even seen our peak. And there are others that say, oh, no, it's like, okay, let's move forward. So can you share, as far as the hospital environment, what their thinking is, or attitude?
I feel like they're precautiously moving forward, but there was an infectious disease physician that mentioned, you know, oh, well, we just, you know, she's waiting for the storm or waiting for the, you know, the second round. And I'm thinking, where was the first round? Like, you know, I've been in the hospital for 25 years. Like, I've seen sickness seasons come and go, and this isn't really any different. In fact, probably less than what I've normally seen. So again, we're not in a dense population area that's, you know, multi-families living in one home from young to old and passing it around to everybody. And I realize that it's very contagious. I don't know, maybe we're doing really good up here in Bellingham, you know, that everybody's following all the rules and it just hasn't been brought to our area. But, you know, I'm waiting. I'm curious to hear if that's actually going to happen, you know. I guess we'll know in a couple weeks now that we're going to open the doors, you know, starting tomorrow or Monday.
Yeah. I'm going to say it's impossible that we did not get exposed. We are between two international airports, two international giant cities.
And
so no,
they were still accepting people early. You know, there were 7 airports that remained open.
Yes.
As the
And
rest of everything was good, and Seattle was one that remained open. I don't remember about Vancouver, BC, if it was one.
It was still open.
Yeah,
it was still open because I called the health department to ask.
I know several people that I've spoken with that believe that they had some symptoms back in November or December before it really was supposed to have been here. So again, it's the unknown. We really don't know. Were those symptoms really positive? It's also very curious to me that it seems like there's a really short window for testing positive. And it's not always super symptomatic.
Every patient that is coming through the ER is tested with a rapid test. And then some are getting the longer version test, but every single person coming through the door is getting a test. Aside from employees. So just so you know, if you go to the hospital, you're getting one.
So or go to the hospital if you want to get one.
Yeah, there's that. Well, I will say the antibody test is now available. Well, actually the PCR, the shorter test, as well as the antibody test are now available through US Biotech. And they recommend that if you have a PCR test and you're positive and you want to double check, because of course, when you're randomly sampling everybody, you could have false positives. So then if you want to do the antibody test, you can additionally do the antibody test. So you could choose just that portion of the test. If you want to check, if you've had a negative, but you're symptomatic, then they also recommend doing the antibody test to see if maybe you missed that window, like Marie was mentioning. And so those are available. It's a test kit I can order, so anybody can do it. It's $119 per portion of the test. So just the PCR is $119 and the other part is $119. And then there's some shipping included. I have to order the test kits. I haven't ordered any yet because they cost me to order them first. But if anybody is interested, just let me know and I will order several test kits and we can order whichever portions that you're interested in. I don't recommend everybody that has no symptoms at all, has had no exposure. I don't recommend that you do these tests because then you're going to have a lot of false positives or anxiety about a partial positive. And it's much better if you have symptomatic or contact to check into that instead. But I do have them available now. They are available for the general public. Can't guarantee about insurance coverage. But that's good to know that the ER is testing. That's
every patient.
That's a good place to
and
check.
That's the other thing. We're not even going to the patient's room unless we have the result first.
Oh, that's good.
So which is, that's less exposure for us, right?
Right. That, or at least
and it's
known, then you know what kind of precautions to take
Yep.
specifically.
And then we have the PAPR, which is the big hood,
Wow.
and it's more, is that almost like, is there more airflow then through the big? Is
So it
almost
has like a little battery pack, and then it has a
Okay.
hose, and the
Yeah.
hose hooks up to the back, and then it's a negative flow. It flows up and around and out. So it's actually kind of cool. I've worn it a couple times. It's like, it's kind of cooling because you get kind of hot and sweaty in those, but it kind of cools you off. Because you got the gown and the gloves, and I'm like, usually you're sweating with all that stuff on, but with the PAPR, it's like, oh, free air conditioning.
Yeah, right. Yeah, and for most, for most of the general public, they don't understand all that. When you're putting on, you're wearing your scrubs generally, and then you have to have a gown, and then you're in a mask, and then potentially you're in a hair bonnet, and in gloves, and you're wearing your shoes and socks, and right, okay, and then somebody tests positive, so then there's
Here's my
usually
picture.
another layer. Oh my goodness! Over the top of that, it is very warm. So
it's hot.
as being,
You still have to wear your mask inside.
There's my outfit. I'm just getting ready to go.
They're recommending that.
Yeah.
So,
Yeah, exactly. And
amazing.
people don't realize how hot that is, and how
No,
these
it's very
doctors,
warm.
for doctors, nurses, caregivers, they all have to do this for hours.
the other thing is we have it's called a dirty side and a clean side. So in the ICU, it's completely separate. You're not intermixing patients. So people in the community to know that you're not just going to be out in the general population. If you do test positive, there is a separate wall. It's a whole separate area with separate staff in that area. It's not with the rest of.
That's very reassuring.
Yes.
Because I think that is really the fear, is if I go to the hospital, there's no knowing if I'm going to be exposed, just like being out on the street, right?
So one, they're tested maybe twice, depending if they do the rapid test or they do the long one, and they are designated to a certain area in the ICU specifically. And so they're not just roaming all over the place,
And I know early on, I must say we may not have had all the PPE that everybody needed early on.
I haven't seen the shortage at all. We've had everything we need. Right. And some donations from the community. So
yeah, which is great, because you do, there for a while you were changing a mask. You still have to change a mask between every patient, correct?
So in the clinic, we're just wearing one mask all day, unless it gets dirty, and then you can change it. But we're trying to be mindful of it because we're waiting for what happens if it does get crazy. Right. And in the hospital, same thing, unless we are issued one N95, but again, we're not using them unless we have a known positive patient with that illness. And then we can wear our N95 that's been fit tested.
Well, and the fit test is very important. My guys, one wears SCBA, firefighter. Other guy, they've been issued a full face mask. That's a fit test. That's they go in and they move around.
Yep.
And you
I had to jog in place.
All of those things, moving your head, moving while you're talking. And I will say, some of the cloth masks, if you're a talker, those masks do kind of move around. So you kind of have to tweak it a little. You have to double it around your ears in order to snug it up. There's, I've learned what works for me. And so there's a little bit of a learning curve if you're going to be out and about and wearing a mask, if you're going, into the grocery store, and, you may find that you really do want a good fit if you're going to be a good steward of protecting yourself.
And it's funny to me that they're saying that you have to wear a mask, but honestly, it's this close to your eyeballs. So wouldn't it make more sense to wear your goggles and your mask? Because you need to protect both. It's all in the same place. If somebody sneezes on you, it's not limited to here.
It's very true. Even clear sunglasses, some sort of eye protection.
I think so.
Yeah.
Yeah. At one point, Harbor Freight had goggles that fit over your glasses for workers. I'm sure they're
Yeah.
long gone, but that was something you could do. There's a lot of YouTube videos where you can create your own little plastic shield, like kind of like your picture showed,
Yeah.
that you could do pretty easily, just a foam strip and something
Yep.
to tie to your
Yep.
head, and then that will take the distance, and over your
Yep.
mask is fine because it's still open down here and still gives you some airflow. People who will have glasses get a little bit of protection because hopefully they've got their mask worn properly and then their glasses, but that is not ideal because it's
And-
still open.
But that might be
But
an
is it-
option for people that are
Yeah.
dying with these masks on and they can't breathe, because those
Right.
usually they'll come down to here. I mean, you really are protecting
Right.
from splashes, coughs, sneezes,
Right. So for short exposures, that is a
Mhm.
perfect way to protect, especially like you said, short of breath. I mean, think about people with asthma, emphysema, cardiovascular disease.
They're
There
already
are
on
still
oxygen.
people, right? They're already on oxygen, already have difficulty breathing, already short of breath, and Lord help us that they're wearing these masks, which is, why some people are passing out and getting in accidents trying to wear these things. And so the idea is that you're just protecting yourself for short exposures. There's still people out in the public that don't have someone to help them.
Right.
Communities, at least locally, are really trying to help each other neighborhood wise, or friends or family, certainly organizations like churches, but they're still being people missed. And I'm just so concerned about those who are without any of these supports or helps. Not everybody can. I don't want to order groceries at home. There's always a fee. It's like that just adds to my grocery bill. I can't budget that
Or you
into.
live out where I do and then you don't have that option. So
There's that too.
I tried.
Exactly. Yeah. So I know some will allow like curbside pickup. That's of benefit. But what if you don't drive?
Well, yeah, true.
Wow. I'm curious, since we're talking about all this PE and all that stuff. Melissa, do you want to share with us what you either have concern about as far as access to PPE, or do you feel like you're well supported as a caregiver? What's your thought on that?
I'm not well supported, except through my employer, who has access to gloves and masks. So yeah, no, I couldn't get them anywhere else. I wouldn't be supported.
Really?
So the agency that you work for doesn't supply those things. You have to find them yourself.
Yeah.
Wow.
Well, I think that's
I
where
was
the
fortunate
homemade
enough
masks can help, right?
I was fortunate
Yes.
enough to have a friend who actually called me because my husband is senior and not in very good health. And so she had a stash of N95s that she sold us a box. But, that was because she called me. I wouldn't have been able to have gotten any supplies otherwise.
I have a family member in the Midwest that sewing is her passion. And so she says that she's part of the mask mafia. They have a very well organized Facebook group. They have drivers, and she herself has made over 700 masks.
Wow.
She dropped 100 of them off at the grocery store. She took some to the senior center, to the VA hospital. I mean, they've gone everywhere because exactly that. Not everyone has the ability or knows somebody that can sew, and they're in a very sparsely populated area. So, it's not like you could go just find someone. So the fact that they have drivers dropping things off to the VA hospital, to the rural hospitals, all of that, they've gotten a pretty tightly organized group, and they did secure somebody to track down elastic, because it's funny, some of the terms that have come out, they feel like they're part of the elastic cartel, because it's a highly sought commodity. So I think that really what some of the positives that we've seen out of this is community coming together, and if there's a need, being willing to express the need, and allowing that to be fulfilled and gifted, or however that happens, has made for the wonderful connections of strangers and neighbors, and still not without stress. I mean, you know, but really we are seeing this community, humanity of people coming together for the healthcare workers like Stacy that are, you know, going into the hospital every day, or hopping on an airplane to go to a rural hospital. Um, Dr. Grobe, seeing folks as a naturopath, and I don't even know about, you know, acupuncture, if people are still coming, you know, that's one of those more up close kind of things. And I think as restrictions are relaxed a bit, we'll see people taking the time to come in. Finances have been difficult for everyone. Um, so I'm hopeful, and maybe we've done a really good job of donning masks, uh, and will continue, that when the next cold and flu season comes around, we won't see the numbers that we're expecting.
I fully expect this flu season for people to do what we should have been doing all this time, is if you're sick, stay home.
Yeah.
I think that we're going to see that for the first time in a long time. I know the reasons we don't is we're the only one who can do whatever it is. I don't feel bad enough. I need the money. I lose my job if I don't. I think after this that there may be more responsible decisions made on the employers as well as the employees to actually do those. And this, I consider this in a way a test to see how we do doing certain things at home, if it's better. And I think, Marie, you shared that a business actually discovered that they had better efficiency with people at home. These must be the
Yeah.
non-drinkers.
Yeah, right. They're working 6 hours. It's been reported they're working 6 hours a day and getting 8 hours worth of work done. And many of them are, they've had to become more efficient and time conservative, because they may be homeschooling or helping a child at home. And so they're becoming very focused. I've heard from a couple of kids in my neighborhood that see their parent doing schooling or see their parent working, and they've learned responsibility and respect and just all the tasks that mom or dad does. In observing, they're also learning, modeling good behavior for professional, witnessing professional behavior when mom or dad are working on the computer. And so I see far more positives in that regard. I'm certain there's negatives. I mean, there's a lot of, and we don't have to get into all of it, but, people are at home. It's stressful to be at home with a spouse. You have that population, that population of people that are domestic violence and that kind of thing. There's been some escalation in certain parts of the country.
Yep.
Unfortunately, even in our own little town, homicides are up. It's so, there are numbers that go with all of this. But the majority that I'm hearing are positives. Spending more time having meals together, getting kids to prep meals, all of these kinds of things, and hopefully learning a little bit more sterile procedure and proper donning of PPE. I think honestly, in the long run, really helps us as a human population.
Yeah. I agree. I see very positive going forward, at least until fall. I do have some reservations about what's going to happen in fall as far as people's health, mental health. If I'm concerned that even if we weather this beautifully, that normal flu and cold season is going to panic people. And I'm worried that there will be an overreaction on everybody's stage, everything, whether it's the political government as well as the individuals. The positive of that, I think, though, is that what I mentioned before is that people are going to be more responsible about the choices they make when we're in that kind of season,
So one good
dietarily,
thing,
environmentally, and work.
but like you were saying earlier about people being more responsible about staying home, and it does really go back to the employer and making sure that you're not felt like you need to be there. And the one thing our hospital has done, and is just rolled out last week, is they did put a bank of 80 hours for anybody that did get this illness, that they would not feel like they had to come to work because they're guaranteed those 80 hours. And as of this last week, they're extending that through the end of this year. So
Excellent.
it doesn't have to be from just that illness. It means illness in general. So that's
Yay.
huge. I think that people aren't going to come to work because they're going to know they have that cushion to stay
Yes.
home and get well before they actually come in. And so that'll cover our next flu season, right?
Yeah.
So I was really
That's
happy to see
perfect.
that. I
Yeah.
was like, oh,
Yeah.
I can't stand it when people come to work sick. I'm like, stay home.
Yep.
You know?
Yep.
Right.
So
Right. Yeah.
Yeah.
And do feel comfortable enough now to do a Zoom consult. It's like, oh, I need my medication refill. I need this or that. It doesn't necessarily have to be, unless you need a physical exam. Doing a video consult with a practitioner is a wonderful way to still be in touch, and get your needs met. And the actual in-person visit can wait a little bit, but
and
don't
that's
neglect
just
your
a
health.
new thing, right? That's kind of cool that like they're kind of forced to do that now, but I think a lot of them will continue to do that, which it makes it easier on for a lot of us, that are working or just have a blip of time at lunch, and we can make that appointment and not have to drive somewhere and park and then get back in time. And
Right. Yeah. No, it has certainly lessened the stress in that regard, because time matters, and we are crunched. But I do see the absolute need for, Dr. Grove needs her data. It's wonderful to have somebody go off and get their labs drawn, and then have that data in front of them when you sit down, and discuss those things, because we are still dealing with our ordinary everyday health issues, whatever that may be, whether it's thyroid or hormones or, just kidney swelling, who knows, right? There's all of that is still happening, and we really can't ignore that, because you will end up seeing very sick people at the hospital and in the ER.
yes, our nurses are calling the patients ahead of time, just like they would prep a chart, and they're talking to the patient, explaining to them about their phone call appointment and what they need to have, arranged before that appointment. And they're sending those orders, like you were saying, with the labs. And so they're doing all of that beforehand, because a lot of elderly people are super confused about this type of office visit because they're so used to coming in. And I think just preparing people and helping them understand it before it's going to be a good thing.
Well, and technology, I mean, it's not everybody is willing to learn that new technology. And so I think that, the teenager may be helping grandma or grandpa
Exactly.
figure out how to put it on their device, on their phone, or, and so I think there's a lot more cooperation that way. But I think it's wonderful, because in the long run, I do believe, that you have to have that advocate. And so having it recorded, even being able to play it back, all of those kinds of things just really make it very, very helpful for the patient.
I want to say, from my perspective, I've always offered like phone appointments, because sometimes I don't need to physically see the patient to get a check-in or update on things, sometimes emails. And so for me, the only new part is really the video part. I'm a technophobe, usually can't stand it, but I'm learning, and to me the video is preferred simply because I like to see the patient. There's a lot of observations from a medical perspective that you can get from seeing a person. The disadvantages are any colors can be really off, and obviously I can't do the pulse or blood pressure and that kind of stuff. And so I I prefer in person, obviously, for those things, exams. The acupuncture side that I do is probably suffering the most because that really requires more close contact. It doesn't require touching as much. I can put a pair of gloves on to check your pulse, and I can wear a mask, and you can wear a mask, and we're fine as far as talking to each other. Because the needles aren't touching you, the needles are touching you, not me touching you.
And they're
So
sterile, so
yeah,
it's,
and they're
yeah,
sterile and used once, and these are protocols set in back when HIV was scary because you couldn't just look at someone and know if they had HIV, and a lot of people didn't have testing. So this is very similar to this experience right now,
yes.
where you just never knew who had it. And that's where we went from needles that you sterilized after a patient used and then reused them, to where you saved needles for known or suspected patients in their chart, even though you still sterilized them, to we're just going to get all sterile disposable needles. And I chose that when I started my practice. We were right on the cusp of that. And I decided from the get-go, I don't want to question, did I transfer anything to anyone, because there's still too many unknowns. So I just immediately went to the disposable needles and didn't even bother with the reuse, sterilize, any of that stuff. And I've never regretted that decision. And now everybody's doing that, of course. So acupuncture was an optional service to leave open, and I have remained open for that. I will say I've seen one patient a week with
Yeah,
acupuncture.
yeah.
Part of that is because I see a high population of elderly, and they would rather stay at home. And I perfectly respect that. There have been some people in some pretty bad need, including new ones that because they're working at home, they're getting neck and shoulder tension. And so now I'm treating people for the at-home worker conditions. And so, yeah, I think people are feeling more hopeful. Maybe it's spring, maybe the sun's out, maybe we feel like, okay, we've been confined enough. There's more cars on the road. There's maybe more people coming to work, I think,
Yeah.
and even to the optional businesses. And so I do hope that moving forward that things will improve
Well,
with all these positive experiences learned.
it's kind of that in between. I mean, years ago, I'm not quite old enough to remember, but I've heard stories about house calls. When doctors would make house calls, it was the doctor going to the
That's
house.
me.
Yeah. And so that is something I know that Dr. Grove will do. You know, that's kind of really the paramedics come to your house. They're not a doctor, but they're the eyes and the ears for the ER physicians. A lot of times they observe a lot of things going into the house. I know I did when I was an emergency medical technician. And so we carried that information with us when we transferred the patient to the hospital. I don't know that we'll see so much in the way of house calls, but really video is the new house call, I would say, except if you need something specifically like a hands-on or an exam. I know in the UK, they are still doing house calls, and it is very popular there. But, you know, we'll see how it all works
Yeah, there
itself
were
out.
already programs in the work for at-home nurses where they would be traveling, so to speak, but they would be the visitors and get that data to bring back to the clinic or the office, or to add to the patient chart. I was already starting the at-home visits and then this happened. So clearly that stopped. But that is my intention, is that once everything is safe, that for those who feel comfortable, I would be doing that as well. So I do think the learning curve was steep for many practices, a lot of technological, and like Stacy experienced, where you have to educate and train people to how to even use the system and problem solve. And we're in healthcare, we are not computer technicians. So,
Right.
and even the technology available has gone through some bumps and issues as well. So once that's in, I think many things will stay because it's been so positive. But there's still that person to person contact that we're going to have to keep to some degree.
Yeah,
I'm certain of
sure.
it.
Thank you, ladies, for being here today. I really appreciate the insight,
Yeah.
the knowledge, the understanding, especially understanding the caregiver perspective and the willingness, the willingness of people to be out in public, the willingness of people to be able to wear their face mask. appropriately, pinch the nose, make sure it's tight around the chin. Eyewear would be really wonderful, because I do, we can't forget that, there's a whole dental population, right, that they're not back to work. They work in people's mouths. I know they're taking lots of extra precautions, and that's a whole nother topic. But I think moving forward, we can be fairly confident that we're really coming out of this and hopefully able to prevent this big wave in the fall. I can't imagine sequestering in the dark dinginess of Seattle fall and winter. I think mental health would really suffer. So what we do now really will hopefully prevent us from having to be so extremely diligent and in this shelter, stay healthy, stay home, stay healthy, shelter in place kind of thing. So thank you so much for spending your morning, part of your morning with me and bringing us your insights.
All right, thank you. It was fun. I very much appreciate hearing from everyone too. Thank you.
Thanks, Stacy.
Oh, you're welcome.
Thank you, Melissa. Be
Bye.
well.
Okay.
Bye.
Bye.